Next comes the clinical importance. Normal serum bilirubin is less than 1 milligrams per deciliter, and when it exceeds above 3 milligrams per deciliter, the condition is called as hyperbilirubinemia, and the clinical condition is jaundice. So there are two types of jaundice, hemolytic jaundice and non-hemolytic jaundice. Talking about hemolytic jaundice is also called as prehepatic jaundice, and it is due to the following reasons. First is the increased hemolysis. Increased hemolysis can be due to the following reasons. First is abnormal RBCs like spherocytes, hemoglobinopathies, etc. Second, antibodies like incompatible blood transfusion, and third is due to organisms like plasmodium in malaria. Second reason for increased hemolytic jaundice is ineffective erythropoiesis, example in pernicious anemia. Next is non-hemolytic jaundice, that is also called as hepatic jaundice, and it is due to the following reasons. Firstly, impaired hepatic uptake, example in Gilbert's syndrome. Second, impaired glucuronide transferase activity in conditions such as Crigler-Najjar syndrome. Physiological jaundice of newborn. Glucuronide transferase activity in conditions such as Crigler-Najjar syndrome and physiological jaundice of newborn. So jaundice is a condition that is characterized by an increase of bilirubin in blood. As a result, yellow discoloration of skin, sclera, mucous membrane is apparent. It is a common symptom of liver or biliary tract disorder. Jaundice is visible when serum bilirubin exceeds 2 mg per deciliter. So as you can see in the following picture, in a jaundice patient, the color of the skin is a bit yellowish. The sclera is also yellow, and the mucous membrane is also in a yellowish pigment. So talking about the types of jaundice, there are three types of jaundice: prehepatic, hepatic and post-hepatic. Prehepatic jaundice is basically when there is excessive amount of bilirubin present to the liver due to excessive hemolysis. In prehepatic jaundice, unconjugated bilirubin is elevated, and mostly hemolytic anemia occurs in prehepatic jaundice. So coming on to the hepatic jaundice mainly occurs due to impaired cellular uptake, effective conjugation or abnormal secretion of bilirubin by the liver cells. In this, both the conjugated and unconjugated bilirubin are elevated. The conditions in which the hepatic jaundice occurs are hepatitis, cirrhosis, Crigler-Najjar syndrome, Roter's syndrome. Next comes the post-hepatic jaundice. In post-hepatic jaundice mainly occurs due to impaired secretion due to mechanical obstruction to bile flow. This is also called as obstructive jaundice. In this, the conjugated bilirubin is elevated, and it mainly occurs due to gallstones, malignancies or inflammations. Next comes the neonatal jaundice. Neonatal jaundice is generally seen in premature children, premature infants, which occurs, and general symptoms of neonatal jaundice are as follows: yellow skin, yellow eyes, sleepiness, poor feeding in infants, brown urine, fever, high pitched cry and vomiting. So this type of jaundice is basically due to temporary insufficient glucuronide transferase activity. It is frequent and physiological occurrence in neonates, especially if premature. The jaundice is maximal at around 5 days of age, but resolution is quicker if the patient is irradiated with blue light, violet light, which converts bilirubin to lumirubin, and exchange transfusion to avoid kernicterus. In this case, bilirubin is taken as emergency test because unconjugated bilirubin is toxic to brain, and if level rises too high in units, permanent brain damage or even death can occur. Thank you, students. Thanks for listening. I hope you all have understood. Still, if you have queries, you can ask me anytime.